We've had two major coronavirus vaccine developments. Both Moderna and Pfizer announced that their trials were around 95% effective. This paves the way to get emergency use approval from the government.
There are still a lot of questions about these vaccines, though. So helping us make sense of everything this morning, Dr. Mark Slifka, a vaccine researcher at OHSU. Good morning. Thanks for joining us.
Good morning.
So if we look at these first two vaccines to really report efficacy, Moderna and Pfizer's, what are maybe some of the differences between these two?
Well, actually, these two vaccines follow the same mechanism of action. These are both mRNA vaccines, which means that you get injected with basically the blueprints for making the spike protein of the coronavirus, and then your body makes that protein. Your body realizes that this is a virus protein, and it makes an immune response to it.
Okay, so what kinds of side effects have there been with people who've, participated in the trials?
Yeah, so the most common side effects are fever, headache, fatigue, but it depends on the person and it depends on the vaccine.
Have you seen any research to this point that you would really be concerned about in terms of side effects?
Well, we haven't yet. I mean, really what you want to look for are serious adverse events and rare adverse events. And that's why we do these phase 3 trials. Now they've said between 30 to 40,000 people in these trials. And so far what they've said is they've seen no serious side effects. So that's great news.
That is good news. Yeah, there's been a lot of discussion about, if you do get the virus, are you then immune to it for forever, for a year? If you have already contracted it, is it going to be recommended that you get the vaccine?
Well, that's a great question. I think what people would do is really focus on the ones who need the vaccine most. So, according to the Oregon Health Authority plan and in really the nationwide rollout, we're going to begin with healthcare workers and frontline workers, essential workers being vaccinated, and then move forward to people who are at most risk, underlying medical conditions, advanced age. And then we can move on to the more general population, including those who have already been infected with COVID.
So I know this is it's going to be such a process. There is so much talk of who gets it first, but I think there's also a lot of questions surrounding how these vaccines are going to be distributed. Some of them have to be stored at very, very cold temperatures, in very specific settings. Are you at all concerned about the rollout, just the logistics of getting this vaccine to people?
Yeah, well, the good point is people realize that this could be a problem, so they're already working out those logistics. Pfizer, for instance, is doing some practice distribution plans to see how well things work. They're using monitoring of every sample of every dose that's being distributed, so they can make sure that it's staying at that ultra cold temperature. But some of the other vaccines that are in development, like Novavax, can actually be shipped basically at refrigerator temperature. And so we're going to have these very early vaccines, but the up and coming ones will be very easy to distribute.
Okay, so are we thinking a matter of months at this point, longer than that?
Well, according to General Perna, who's in charge of Operation Warp Speed, they're planning on having what he says hundreds of millions of doses available by January, February, or March. And Tony Fauci at the NIH says that every American who wants a vaccine will have it available by April. So we're talking this winter or this spring.
I think that is good news for so many people waiting for this vaccine to be available. All right, Dr. Slifka, thank you so much for joining us this morning. We appreciate your expertise.